Hi everyone, welcome back to another video. Now today our book reading session is all about uh, Kumar and Clark's uh, clinical medicine. ठीक है, आज हम फर्स्ट चैप्टर पढ़ेंगे. So first chapter is ethics, law and communication. Ethics and law. Ethics में इंट्रोडक्शन देखेंगे. देन आपका एथिकल प्रैक्टिस, इसमें सोर्सेस, resources and approaches, ethical theories and framework, professional guidance and codes of practice, the law, respect for autonomy, capacity and consent, confidentiality, resource allocation, professional competence and mistake, communication in healthcare, the medical interview, team communication, communicating in difficult situation, recent influences on communications. Ethics and law. Ethics, an introduction. The practice of medicine is inherently moral. Biomedical expertise and clinical science has to be applied by and to people. Medical decisions are underpinned by values and principles. Potential courses of action will have implications that are often uncertain. Technological advancement sometimes have unintended or unforeseen consequences. The profession has to agree on its collective purpose, aim, and standard. People are much more than a collection of symptoms and signs. They have preference, priorities, fear, and hopes. Doctors too are much more than interpreter of the symptom and sign. They also have a preference, priorities, fear, and hopes. Ethics is a part of a practice. It is a practical pursuit. The study of a moral dimension of a medicine is known as medical ethics. In the UK and bioethics internationally, to become and to practice as a doctor require an awareness of and a reflection on one's ethical attitude. All of us have personal values and morals intuition. In the field of ethics, a necessary part of learning is to become aware of the assumption on which these personal values are based, to reflect on them critically, and to listen and respond to challenging or opposing belief. Ethics is commonly characterized as the consideration of a big moral question that preoccupy the media. Questions about cloning, stem cell, and euthanasia are what many immediately think of when the word medical ethics are used. However, ethics pervades all of medicine. The daily and routinely workload is also rife with ethical questions and dilemmas. Introduction to patient dignity on the wards, the use of resources in clinic, the choice of antibiotic, and the medical report for a third party are as central to ethics as the issue that observe the popular representation of the subject. The study and practice of ethics incorporate knowledge, cognitive skills such as reasoning, critique, and logical analysis and clinical skills. Abstract ethical understanding has to be integrated with other clinical knowledge and applied thoughtfully and appropriately in patient. Ethical practice, sources, resources, and approaches. To engage with an ethical issue in clinical practice depends on discerning di- discerning या क्या है ओके जो भी the relevant moral questions looking at the relevant ethical theories and tools identifying applicable guideline example from a professional body integrating the ethical analysis with an accurate account of law both national and international. Personal views must be taken into account, but other perspectives should be acknowledged and supported by reasoning located in an accurate understanding of the current law and relevant professional guidance. Ethical theories and a framework. ओके सो आज के लिए इतना है यहाँ पर उसको एंड करेंगे 5 फरवरी 26. Thanks for watching.